Right, visible now?
Yes, ma'am. It is
Yeah.
visible now.
So today's topic, which I just want to have it on, nutrition for a healthy lifestyle. So it is much more needed in current, the era which we are undergoing because we have lots of stress and moreover, whatever the work we are doing it up. If you ask me honestly, if people are having a proper nutrition or a proper food, in that sense, we are not having it, and we're not focusing on our health. Also, we are not focusing much on that. It can be your healthy pattern, or even it can be your mental health also. We people are not focusing much on that. We have to stress so much of the thing. We are not focusing on the diet, or even the water intake is being reduced for an individual. Everything. So in today's topic, I just want to highlight. Start with the quote which Mahatma Gandhi ji was telling about the health. It is a health that is a real wealth and not a piece of gold and silver. So we can earn a lot, we can we can spend a lot, but whatever health which we have to get, which we need to have it, that is real wealth which we need to have it up, and not anything else apart from that. So in today's topic, I just want to focus on to discuss what a healthy lifestyle means, and to discuss on the nutrition for a healthy lifestyle. What are the common nutrition that can be put up in your regular pattern, your daily pattern, and to help to identify the health behaviors which we can aim to modify or can aim to incorporate into lifestyle. That can also be we need to focus on that. So what do you mean by healthy lifestyle? If you ask someone what do you mean by healthy lifestyle, they say having a good proper good nutritious food and having a proper sleep. So that comes to the mind for any individual. So good healthy lifestyle is nothing but a good nutrition with proper amount of sleep and a daily work pattern, and that will be the foundation of health and a lifestyle for any individual. And they should be free from diseases, right? Honestly, anybody, if you ask me, anybody will say, I want to have diabetic, I want to be hypertensive. But there are some eras where we are going into it. People will say, like, I'm a diabetic, I'm a hypertensive, I'm on a medication, everything. But unfortunately, people will be struggling to overcome those illnesses also. But we should understand there are aspects for wellness. We have to find it out because how our physical health is determining our social health, wealth, or health also. So when we talk about physical health, it also comprises of your psychological and emotional and even the social. When you're not having a proper sleep, probably in a day, probably if you say if you're not having a proper sleep or proper food, if you're not having to it, do you think the day starts very happily? You start it up. Probably it will not be like a normal routine, or sometimes you will not be having to it. Probably you'll be having a disturbed day and you won't be able to focus on the work pattern or whatever you work your people are doing it up. So this is a common thing which we will be having, we'll be facing it up in day-to-day life. So if you're not having a proper food or proper sleep, probably that will be affecting your physical health and even the psychological, and it may also have an impact on the emotional health also, that will come out in your social health. Social health is nothing but when you talk to your neighbors, or it can be your colleagues, or it can be a friend, or including your family members. So that will affect immediately that will show your anger or your frustrations, everything towards them. So that is one thing that we have to focus on. Right? So what is a good sign of physical health? Okay, if you ask me what is the sign of health is having, you should be very bright, you should be looking smart enough, having a clear eye, clear speed we need to have to it, and even a healthy gum, speeds, and good muscle tone we have to have, and good posture. We need to maintain a posture and energy for your daily living that be essential for any individual, and resistance to the illnesses because we people are more prone to any infections currently. We're facing lots of diseases coming in, by day we can see lots of things. It can be airborne diseases or it can be waterborne diseases, which we are facing it up in day life. Probably that we need to overcome without affecting of those illnesses. We need to run our routine life, and we have to have a good sleep. So relax and have a good sleep is also one pattern we need to have. So what is the negative lifestyle choices? Because we need to choose whether you want a lifestyle or negative lifestyle. So negative lifestyle is smoking and use of drugs, because people will start using the drugs because lack of sleep. They depend on sleeping pills and all. So that is also there. And moreover, they will not having a proper nutrition, which is having an impact on the daily routine. get impacted on it. And excess weight, they'll not be focusing on their pattern, having irregular meal pattern or irregular habits they'll be having to it. Even that could be having, and that could be also one of the negative lifestyles they'll be having to it. And inadequate health care, they'll not be focusing on their health consciously, they will be focusing on it. And poor time management. All these factors will be affecting your time management also. And even at the end, we'll be ending up with the stress is also one of the commonest factors which every individual will be having. So if you ask me what are the lifestyle diseases which has been commonly because of your food and your nutrition or your lifestyle will bring it up. So commonly we can see your heart disease, the stroke, diabetes, obesity, metabolic syndrome will be there, and chronic obstructive pulmonary diseases. And like having asthma or lower respiratory tract infections, they will be having it. And even sometimes cancer is also being affected because of your poor or a negative lifestyle is also part of the reason that could have an impact on that. So there are things which is modifiable factors and non-modifiable factors. Say for example, some of the things which could not be able to modify, like your age, your sex, your heredity, your personality cannot be modified. But with the help of a proper nutrition and proper lifestyle, we can able to modify these factors can be modifiable factors. If you say like your blood lipids can be controlled, your hypertension can be controlled, your obesity can be controlled, your diabetes, your hyperlipidemia, smoking also can be prohibited, and even the sedentary habits also can be prohibited. So you can able to mobilize, you can do your routine work. Apart from that, you have to do some sort of exercise. With that, we can able to modify all of these factors. We can able to control with our own. So that is what it comes under some modifiable factors. So these are the non-modifiable factors which we generally call it as. So I want to go about the nutrition at all age groups and from starting from men, women, and adolescents, and even the pediatric kids also. So starting from the men generally require more nutrition than women because of the larger body size, because of the height and weight, and even the activity level also differ among the men and women. It will differ. But currently, I think most of them we are even equally balancing men and women. We are, traveling the same. We are having the same level of work pattern. We are having women, so that is also will be the thing. Maybe the muscle mass, the body, and the height and the body surface area. So that might be the one of the thing which we require more nutrition. We have to focus on women. And they also require increased camping needs compared to the women because of the working pattern they will be requiring women. So what are the commonest nutrient that is essential for women at all stages of their lifestyle? Maybe you can say from the childhood till the old age. These are common nutrient that is essential that has been identified as one of the major nutrient that is required for a man. It is like they need to have more protein. So why men needs protein is during the weight loss or even they might be needing for the muscle mass build a muscle mass also they need to have it. As I said earlier, for the height and weight, they need a good amount of protein. They have to have it in the daily routine. They have to have it. And they need to focus on the fiber intake. So fiber intake, if you ask any client who comes into my clinic, if I ask about the daily routine, about the food pattern, how much greens they are having, how much vegetable they have consumed, how much of foods they consume, most of them they'll be giving, they could say I had greens a day before or a week before, or even they'll be saying once in 3 days. Very rarely they'll be giving an answer. So that is the reason, the fiber consumption has come down in all age group and all category of people. It has come down. We need to focus on the fiber intake is essential for all age group of people. They need to have it. And omega-3 fatty acids that is essential for their muscle mass, and even that acts as an anti-inflammatory property also. So that is essential for all age groups, and including men, that is essential for them. And potassium is essential for them. Magnesium, vitamin D, and selenium. So I in my upcoming slides, I just tell you what are the sources of these elements. In the nutrients we can get it. All this, what are the food sources we get all these essential nutrients. So when you focus on the women, first phase is the pregnancy. So it is not like a normal women. Based on the activity level, the calorie distribution or the calorie nutrient intake is being determined. When you come to different phases of the life, in a particularly in a women, when they undergo pregnancy or lactation, they need higher calorie and higher protein than the normal. So because they're eating for the two, so what they eat is dependent. It is also essential for the baby's future growth. Is also determined by the mother, whatever she's consuming during the pregnancy phase. So that is during the first trimester. They need to increase the calories by 100 kilocalories and even 300 kilocalories. Gradually, they can increase. They need to increase it up. And during the second trimester, increase the calories by 300 to 400 kilocalories from the usual calorie they have to remove. So that is essential for the baby's growth, even for the mothers, for the future health is also. This energy calorie requirement is essential for them. So during the lactating phase, a woman need extra calories, 300 kilocalories, as she's feeding the baby, and moreover, whatever the nutrient she's consuming, that is being distributed to the baby also. So whatever the nutrient she has, this is omega-3 fatty acid she has, and even the DHA, we all know the DHA essential for the brain development and brain functioning for the baby. So that is also essential for the baby, and even the mother is also essential for them. And cutting down on caffeine products, because why cutting down on caffeine is because generally during the phase of pregnancy and lactation, most of the mothers will become anemic, and even normal phase also we can see most of the women will be having low hemoglobin levels. So that could be a contributor. Will further deplete all the nutrition factors also. Will be depleting the iron content, iron level in the body. So they have to cut down. Why caffeine has to be cut down? Is generally the caffeine has been it has been noticed that it will reduce the absorption of iron, what is present in your food items. That is the reason why we need to cut down on caffeine content. And they need to have a small frequent feed as much as possible because they are frequently feeding the baby. They need to have sufficient amount. The mother should have. So that is the reason of small frequent feeds they need to have the bed. And emphasize on the healthy source of protein and calcium. So when you talk about the essential nutrient, when we say about omega-3 fatty acid, DHA, the calories and protein, and they need to have a sufficient amount of protein as well as calcium because that is also essential for the lactating mother. That is essential for them. So when you focus on the children it's a developing phase where that is will be determined the future also. So whatever the nutrition that has been given during the childhood, that will determine the child's growth, and even the developmental factors is also determined by that. Nutrition, what is being given that during the early phase of the life, it has been determined by that. So there will be child's nutrition also will affect your physical, emotional, and even the intellectual development is also being affected when they are not proper nutrition is not being given to them. So that is what nowadays we are having lots of government schemes which we are having to it. So why they started on implementing on the breakfast scheme and lunch scheme and they have implemented. So even that have a better outcome for the kids. So once developed, more eating habits also will be noticing it up. Do you think all the kids will have whatever it's been given on the plate or whatever been packed in the lunch? They will not be having it. Only half they consume or only three-fourths they have consumed it, or even the quarter portion of the food that is being consumed. But I think most of the schools they started introducing that during the lunch they'll be noticing how much the kid is being consumed, whether the kid is having proper or not, or they're having sufficient amount they're getting it done, or yearly once they do the health checks and all that is being carried out. So that is a good thing which we can able to focus it up at that school level. And as a parent, probably we have to think about the kid whether they're having sufficient. Because we people are feeding them the sufficient given to them. Because once the age goes, once the age factor determines, they'll be very clear. They won't focus on what is being given to them. They'll be half eaten up, half it is not consumed. That is also will be noticed that. And we have to give them the options also we need to give them because they have lots of likes and dislikes also. So whenever you are giving producing any food items, try to have all the food family sit together and have the food item at least one day in a day. Or the whole family, we can make them to sit around and we can have the food items because we need to emphasize on the unless otherwise the parent we started educating the kid they won't be knowing the importance of the nutrition, they won't be knowing about it. So you started having the food properly. After seeing you, the kid will start having to it. So, and moreover, we can find out what are the likes and dislikes or the feature, or if the kid is having any allergic reactions or anything like that, or tolerance also, we can able to identify. At the earliest, we can able to find it out. And new food also can be introduced as much as possible. And children has also been involved in food selection and while food preparation also. whenever possible, we can involve them whenever we are going for a grocery shopping or a vegetable shop shopping. We can involve them for them. They also should understand what's happening to that. What is the vegetable, what is they are rich in, and what is the need for it. Everything we can tell them at the earliest at maximum we can educate them. And then from the childhood to the adult, there is an in-between phase, what we call as the adolescent phase. That is a transition stage of physical and mental development that occurs between the childhood and the adult. So, which the period is which we World, according to World Health Organization, the period of life between 10 and 19 years, what we call as adolescent phase. So, during this phase, particularly for the girl, they'll be going under during a puberty phase. So, during that, the growth will be very rapid when you compare with the boy and the girl. During the adolescent phase, the girls will be having a development will be very rapid compared with the boys. So during that, they'll be having a good spot, will be having height and weight, we can able to see. There'll be lots of hormonal changes to be happening in the body. So we need to help them out to overcome those difficulties also. Because some kids you can able to see they'll be very lean and emaciated or something like that. But after the puberty phase, they'll be having lots of weight, they'll be having to it. Maybe it can be genetic factors that we have to it, or at the earliest, because whenever they have the grandparents at the home, they start overfeeding the kid after puberty. So that is also happens in most of the families that we were able to see. They'll be overfeeding the kids in it, that will lead to child obesity also. It can be one of the things that can happen in puberty phase. And they'll be having lots of considerable gain in the muscle and bone mass we can able to see to it. And particularly in a body composition, that is what I call increased deposition of fat in girls we can able to see to it. So they also an essential energy nutrient, essential nutrient is essential during puberty, particularly iron is essential. So during the premenstrual syndrome, the diet plays a very important role in during the premenstrual syndrome. So they have to focus on iron and zinc food item, rich food item, and even the calcium is also essential. Mineral content that is essential during this particular phase. We can avoid trans fat as because, as I said earlier, we have a fat deposition will be happening to them. They can cut down on trans fatty trans fats in the diet and even the deep fried items or sugars or something like that. Maybe once in a while, can feed them, giving them a deep fried stuff or sweets or pastries or something like that. But it should not be a regular routine or something like that. That's what I just want to have it. And we can cut down on salty items also. So just think about it when we have a chips. Will we stop with one piece of a chips or something like that? We will be able to, because that craving will be there because salt has an tendency to make every individual to consume more. So that is the reason we have to control on the salt consumption, not to add it while cooking, that will be safer for everybody, not having any extra salt. Maybe once in a while we can go ahead with either the numpkins or chips or something like that, but it should not be a part of your diet or regular routine diet. It should not be there because most of the kids I've seen they're packing the lunch, they give on chips packet or something. So, do you think that will be a healthy lifestyle? It's not a healthy lifestyle that they are following it up. So, we need to give them a boiled chana or something like that. Something which we can give them nutritious. We can pack it up for the lunch also. We can do it up. So, they'll be having some food sensitivity also during the premenstrual syndrome. So, that is also we have to look into it. And what are the food items that causes of the premenstrual syndrome? As I said earlier, they'll be having some intolerance or they'll be having some allergic reactions also might be happening. So we need to focus on that and we have to start feeding them in. So during the menopause, later stage of women's phase, the menopause stage, where all the reproductive system will be prepared to retire and the body shifts its production from the so automatically during the menopausal phase, the women becomes very, during the menopausal that particular phase they'll be little irritated or frustrated or something like that. They'll be throwing it out somebody. So this is a common thing they'll be knowing. This is because of the hormonal changes that will be happening inside the body that will be happening to them. And during that particular phase, they have to focus on the calcium intake. As much as possible, the natural sources can give them and they can cut down on the sugar content as much as possible. White flour and coffee content because the anemic reason we have to cut down on coffee as much as possible. And they can focus on having a good fat as much as possible. They can try flaxseed and for the hot flashes. And even they can have that, we can include it. And the elderly population, the last phase of the life, we can see to it. They'll be having lots of age-related problems they'll be undergoing, right? Like hearing loss, they have it, cataract or refractive errors, they'll be witnessing it up. Some of them will have back and joint pains, they'll be witnessing it up. And of course, they have chronic obstructive pulmonary diseases or even lower respiratory tract infections, what we commonly call as. They'll be having a little bit of wheezing problem, they'll be coming up, or even diabetes multiple comorbidities, what we call as hypertensive, or they might have cardiac issues also. And some people will come across depression and dementia also. So in that one phase also, we have to focus on the diet. What we during that particular phase, we need to focus on their diet also. We have to do it. So this is what we call as my plate. During our school days, we used to have food pyramids. So nowadays, it has been changed as my plate. Earlier, we used to have 5 food groups, but currently we have come up with 9 food groups we are coming up. So nothing but it is the same thing that has been distributed evenly as 9 food groups. So 33% of the starting items which you should have it as a form of carbohydrate, and 15% in the form of your milk and the dairy products we have to have it, and less than 8% your fat, and 12% should be your protein sources from your vegetarian, from your non-vegetarian sources, and 33% from the fruits and vegetables you have to consume in a day. So this is a distribution of the plate that we have to consume in a day. We need to have it. So this is what we call as our dietitians recommend or something like that. So I wanted to tell you how to determine the calorie for a patient or an individual comes in your clinic. So nothing but it is based on the activities will be determining the calories. For example, if a man who's having doing a sedentary work, the ideal body weight for men and women will be common for the activity level also. So when you say about the sedentary work, I need around 2,300 kilocalories. If it is a moderate work, they have to consume 2,700 kilocalories. If it is heavy worker, they will have to consume more than 3,000 calories. They are equivalent. If it is for women, similarly, the sedentary worker, the 1,900 kilocalories, moderate is 2,200, heavy workers is 2,800. As I told you earlier, during the different phases of the life, like pregnancy or lactating mothers, they have to increase the calorie as much as possible. They have to consume it. So when you say about it, if already a person is obese, do you want it to stick on to the same calories? It is not essential. I'm just giving a gist about it, how to determine the calorie. But based on the height and the ideal body weight, we can determine the calorie, which is essential for your day-to-day life. We can determine it. So similarly, we have the micronutrient like vitamins and minerals also we are having for it. And whatever the calories, so ma'am, you have said about the calories, how to say how much we need to burn and how much we need to consume. So for example, you are consuming your calories, say about 2,000 calories. And this person will be around, they will be using 500 kilo work activities or anything like that, whatever he's doing it up. Around 500 kilocalories is being burnt off. So that is, he'll be using 1 pound in a week, he'll be using it. If a person is consuming 2,500, almost 2,000 gain and 500 kilocalories per day, he'll be gaining 1 pound a week, he'll be having extra because if it is not burnt, then he'll be gaining 1 kilos, he'll be gaining in the weight. If it is 2,000 and 2,000 calories is being burnt off equally, or his free food is being burnt through his physical activity, or if in case he's additionally doing some kind of exercise or something like that, probably even that could be burning some of the calories if we distributed. So we all know about the body mass index, BMI. So ma'am, I don't want to know about all this thing. How to easily go about my height and weight, whether I'm overweight or I'm underweight. So with the help of your BMI, we can able to identify whether you are overweight or you are underweight. So BMI is a measure of body fat based on your weight in relation to your height. So it implies to most of the adult men and women, and even the kids also we can have it. But less than 2 years, we'll go about the BMI percentile. We'll go for it. So this is how we'll calculate the BMI, your weight, your current weight. I want to calculate what should be my ideal body weight. So nothing simple. Your height, for example, you're 65 centimeter minus 100. That will be your weight. So 65 kg, that is your ideal body weight. So how to calculate your BMI? I've given a simple example. I given you your weight, your current weight by height in meter square. For example, current weight is 68, and my height is 165 centimeter. 65 by 1.65 into 1.65 is 24.98. So that is the thing actually. I how to determine whether I am overweight or normal or obese or something like that. This is the World Health Organization had given a classification. This is simple weight they had given to you. If you fall between 18 to 25, it is a normal weight you're having. Fit. And if it is between 25 to 30, it is an average. And if you fall between 30 to 40, then it will be morbid obesity, your overweight and your obesity will be noted down. So we need to be little alert on that. Even if you fall under 25 to 30 itself, we have to be little more cautious on your further weight gain should not be happening. You start reducing or shedding your weight as much as possible. And if you're falling between 30 to 40, you're already obese. So try to further focus on your diet and your lifestyle management. We need to focus on it. And if it is above 40, then that will fall under morbid obesity. It is severe category. There will be chances for having your, as said, lifestyle also may be occurring in that particular phase. So we have to focus on your diet, your lifestyle management. We have to focus on that. And essentially, we have to check on your health also, health record also. We have to look into it. So this is how the calorie content normally we have seen in days also we have seen to it. 1 gram of carbohydrate gives you 4 kilocalories, 1 gram of protein gives you 4 kilocalories, and 1 gram of fat gives you 9 kilocalories. So how much ever the carbs you're consuming into 14 to 4. So that will gives you the amount of carbohydrate you're consuming in your meal. And if you're asking for protein, the similar way, like say for 4 grams, how much protein you're having into 4, that gives you the consumption of grams of protein you consume to it. And if it is for the fat, then it has to be calculated into 9. We have to calculate the amount is what we are getting, the amount of fat you have taken from the day that is being taken to it. So nowadays people started cutting down on calories, or they started focusing on a specific nutrient. Say cutting down on carbs, focusing on only on fat, or focusing only on protein or something like that. If you ask me, is it a right way to cut down on carbs, protein, and fat? I'll say no. So that is not essential way to do it, because we need carbohydrate, we need protein, we need fat for your daily routine, for your daily activities, and even for your normal functioning, the organ function. So we need some carbohydrate, for protein, and even the fat is essential for it. So that is the reason. Please don't do any dieting on specific onto your carbohydrates or proteins or fat or something like that. Because I'll tell you, so people should understand why the carbohydrate, the calories is essential for you. Even your protein sources gives you some calories. Your fat sources also will give some calories. It is not that cutting down only carbohydrate will cut down on calories. It is not so. Even the protein sources gives you some calories. Fat will be giving to it. So we need to have all these in moderation. Your daily activity and daily function of your organ also is essential for you. Almost 19% is essential for your brain functioning, and 10% is essential for your kidney, and 19% for other organs also. And if you 7% for your heart, and 27% for your liver, and 18% for your muscle function is essential. So almost 70% of the calorie needed is needed to keep up you alive, and 20% is essential for your physical activity and digestive process. It is essential for it. So don't cut down on your carbohydrates or protein or fat or something like that. Have everything in moderation. That we with the very best practices, as I do recommend for my client. Cutting down on carbs or fat will not do any bring out any changes in your body or something like that. So this we have already seen the carbohydrate and protein. The carbohydrate is nothing but your energy giving food items, and protein will be your body building, and your vitamins and minerals will be your pretty food items. So that's said earlier, 60 to 70% is essential for metabolism, 10% is essential for digestion, and 20 to 30% is essential for your activity level. It is being essential. So the calorie requirement, the classification of the nutrients. We all know carbohydrate, we get it from your sugar, starch, your cellulose, and even that provides some energy, it provides to you. And when you talk about tea, it is essential for your bodybuilding and your growth and repair of your tissues. It is essential for it. And when you talk about fat, it is essential for your body to build up your muscle flow for future use also. When you're cutting down, or when you're in a starvation process, the fat is being the only source to be providing your calories for your organ functioning. So that is the reason we need to have some fat also. And currently water is also being essentially added as one of the major nutrient in your diet because that is essential for your hydration. Body is made up of 65% is your body is being functioning with water. If people doesn't know, because it is essential for your metabolism, your everything, it is the water is essential for it. For transformation of your nutrient from one place to the other, your metabolism, your caloric distribution, everything, water is essential for it. And your vitamins and minerals is essential for the chemical process that is happening in your body that is being essential for your vitamins and minerals. So, what do you, how distributed carbohydrates or the protein in your diet in your daily routine is nothing but you can have carbohydrate in 3 servings daily. So we need to have carbohydrate every day, and on 3 meals we need to have it. So have focus on low GI, which will release your energy in a very lesser quantity, and it should be having a higher amount of fiber content also. So in spite of having as a normal rice or normal wheat or something like that, whole means it is like whole cereals or whole pulses we need to consume in time, because whole means it has fiber supplement in it. That's the reason, which will reduce your risk of becoming a diabetic or a hypertensive, even hypercholesterolemia, and even cardiac issue also can be prevented when you have whole cereals and pulses. We can take it off. So the ideas behind this is nothing but cereals and cereal bars. We can have tea, we can take it out. We can have quinoa, we can have wheat, we can have brown rice, we can take it out. Nowadays, people started focusing on millets. They have focused on it. So even that is essential for you. That is we can have it. So protein, when you say protein, it is not only from the vegetarian sources. We have non-vegetarian sources also we are having it. So what could be a better option of a protein alternative in your diet? So we have to take in moderation, even the protein, whenever you have non-vegetarian sources, try to have in moderation on daily basis. So if I am having eggs, probably we can have 2 egg whites a day, we can have it, because whatever the Indian diet which we are having currently, you ask me in a day the consumption of your protein in a day, it will not even 20 gram will be consuming. Think about 1 gram per kg body weight of a protein we need to consume in a day. But whatever protein we are consuming, it is lesser than in the recommendation we are consuming. So probably we can have the protein supplement, protein instead of going for supplements or something like that. Try having a natural protein system as much as possible. So choose lean fat or lean options wherever possible. Cut the visible fat of meat products and avoid protein skin as much as possible. Try avoiding your processed food items. Try to get the fresh ones and use it up. Don't get the fat ones or sealed ones or the tinned ones. You can avoid it. Even that is high in saturated fat content. So that's the reason even they'll be adding salt solution for marinating food. So even that is not a source for a good thing option for having to it. And if you're having a non-vegetarian and particularly fish, have rice or fries also is being recommended by the dietitians because it has omega-3 fatty acid. It is essential for all in it is essential. So we can have fish, we can have rice, we can have in a day, we can have it. Egg whites also we can have twice a day, we can have it. And if you're having soy, you can have in the form of tofu or a soybean or the nuggets. We can soy nuggets also. We can have it. So the milk and dairy products we can have like 2 to 3 portion a day we have to consume because milk, all these dairy products will also contribute some amount of calcium in your diet. So whatever milk products we are using, try to use low fat. We can try having it. So have milk, low fat milk or cheese or yogurt. We can have it. Healthy adults should consume low fat options we can have. And even plant based, because some people will have lactose intolerance or even they'll be allergic to milk, products or something like that. In that case, how do I compensate my protein intake in a day? That will be the biggest query most of the clients will be having. So probably we can go ahead with plant-based proteins we can have, but like milk drinks like almond or soy milk also we can have. But even that will be serving a good amount of protein they'll be providing to you. And even the snacks we can try with yogurts or we can have strawberries or blueberries we can have. But, and which will also be giving some sweetened yogurts also it's available in the market. Even once in a while we can go ahead with that. Or even whatever coated yogurt or a buttermilk, even that can be taken on a daily basis. We can have it. So next comes the fat. So fat is essential. It is not that we have to we cut down on fat when we go for weight reduction or something. We need essential, as I said earlier, we need to have some carbohydrate, protein, and fat, not only for your daily activities, even for your organ function is essential for it. So we have good fats and we have bad fats also we have to it. So which are essential fatty acids, that is, which our body cannot be synthesized internally, that has to be supplemented to our food sources we need to supplement. So some of them will have the saturated trans fat or saturated fatty acids or trans fatty acids, which we get it from the animal products, which will increase your blood cholesterol. So probably, if you ask me, ghee, whether it's a good source, ghee is a good thing. Probably we can have ghee, which is a good, but the consumption and the amount what we use in a daily routine, we have to think about it. Have moderation of ghee consumption daily, we can have it up. If you're having already a known case of diabetic or are having a cholesterol, high cholesterol or something like that, probably we can cut down the consumption for some time. And once if the levels are normal, we can have, but the usage should be in moderation. And we have the monounsaturated polyunsaturated fatty acids also, which we get it from the plant sources. So they'll be having, like from olive oil, or you can have corn oil, and even sunflower or sesame oil, which will reduce the blood cholesterol levels. So try to use as much as from the plant sources as much as possible. You can use it up. Or a combination of fat, using the fat is also a good option for using it up. Instead of using a single branded oil like sunflower oil or ginger oil or something like that, use a combination of oil can also be used in a daily routine. We can improve it. So omega-3 fatty acid, which is essential fatty acid, which is our body is not being synthesized and it has to be given to your diet form, we have to take it out. So that can be from veg source and even a non-vegetarian sources we have it. So vegetarian sources we get it from almonds, walnut we get it, which will be helping for a healthy heart also. So to keep your good cholesterol at a normal level, to a higher level, your HDL level should be higher and your LDL level and be at the lower end. So to improve your good cholesterol, we can have almonds and walnuts. We can have it on daily basis also. We can take it out. So what about the non-vegetarian sources? We can have fish varieties. We have lots. Has omega-3 fatty acids. We have sardine and salmon. Mackerel we have it. And herrings we have tuna. We have with swordfish, halibut, and trout. Also we have a good amount of good sources of omega-3 fatty acids. We get it from these variety of fish. We get it. So how to reduce the saturated fat intake? Maybe we'll not be going into it. So try to use the preparation, the way of preparation we are doing. Preparation can be modified. Try to grill or boil or steam, we can do it up. Instead of having a deep fry, we can have a grilled or a shallow fry, we can fry it up. Or even the boiled one, we can fry it up. Cutting down on visible fats, like whenever you're getting a chicken, remove the skin and use it up. Because even the chicken skin has some lots of fat will be producing while cooking. So that's the reason skim while cooking that can be done, and even can skim the fat as much as possible. Use an olive based or a low fat spread instead of butter. So that also can be an alternative we can use it up. Choose low fat dairy products whenever possible. And the hidden sources of fat is also we have to try to cut it down. From the nuts sources we're getting it. So that is the hidden fats which we know commonly use. But so that also can be used in moderation. So what are the food items that are rich in calcium and rich in fiber? Generally, we all know about the milk and milk products has a good amount of calcium. So particularly some seafoods also have a good amount of calcium, and even certain vegetables like turnip, mustard, bean, broccoli, cauliflower, legumes also we have. So these also have a good amount of calcium. Simple ragi and even the black gram dal has good amount of calcium. So obviously we people use the black gram dal for making idli or vadas that are being prepared to it. And even ragi is also a part of nowadays part of a daily routine. They started using it. Even that contributes a good amount of calcium we can it. So try to at least once in a week or twice in a week when you incorporate in your diet, incorporate ragi and the black gram dal you can have it. So fiber rich, all the vegetable and foods has a good amount of fiber in the diet, particularly all the leafy vegetables, whole grain cereals and pulses can use it up. Instead of using the polished one, you can have the whole grams and pulses you can use it up. So zinc deficiency is a common thing which we know noticing it up. Most of the nowadays young age and even the middle aged and even the elderly population also started saying like I have hair loss, lots of hair loss. I'm facing it up. They'll be noticing it up. They'll be having lack of sleep. Everything will be determining. It is not only one particular nutrient or something like that. It is all determined by that. But there is one specific nutrient we need to focus on that whenever we are having a hair loss also. So the zinc deficiency occurs during chronic illness alone. We'll be noticing it up, but most of the time we won't look into it. So when the zinc deficiency occurs is mainly when you have excess consumption of alcohol, even that will lead to zinc deficiency, and during stress or the trauma, and during a major surgery, or even a malabsorption phase also, you have zinc deficiency, you noticing it up. So what are the symptoms we can notice because of this particular mineral deficiency is like they'll be having good carnation and even skeletal deformity is also being noticed, particularly for the pediatrics, but particularly for the kids, we can notice it. And poor healing. Whenever they have a cut injury or something, it won't heal much faster. They take for time, or it will have pus formation, or some oozing will be there. It is all because of zinc. So that is the reason they'll be giving a combination of drugs they'll be recommending whenever you have any injury, or whenever you have a fall, or a switches is being done. Probably they recommend on zinc also is being recommended for that. And some of them will have dermatitis or delayed sexual hyperglycemia, and some of them will have hair loss, and some will be having immune function, impaired immune function. They'll be more prone to infection more frequently. Some will be more prone to infection since they'll be getting cold or even a fever or something like that. More frequently, they get infection out of it. If anybody sees it up immediately, the next day the other person will be having cold or something like that. So that is also will be noticed down. So that is a common thing in the zinc deficiency we can notice down. So what are the sources of zinc? Generally, non-vegetarian sources are the good amount of zinc we can see to it, like particularly red meat or seafoods we have into it, poultry, pork, dairy products we have, whole grains, leafy vegetable. And you're talking about very vegetarian, non-vegetarian. What about vegetarian? We have all the nuts, all the seeds, flax seed, pumpkin seeds, and even those, combination of seeds we are getting right now. So that can be used as an alternative because even that contributes to zinc amount, zinc in your diet we can have. But so next comes the iron. Because of iron deficiency, most of the women will be facing it. At all phases of the life, they'll be having the low hemoglobin. So this is the commonest one every women will be having it. So what is sources of iron? If you see, it will be iron-rich item. Particularly, we can get it from the soybean, oatmeal, we have it, raisins, we have it, eggs, we have, shellfish, we can have that. They have whole grain breads, we can get it, red meat, and even the chicken, turkey, we can have. Green leaves, particularly palak or drumstick leaves, have the good amount of iron in it. And simple rice flakes, poha. It has also had a good amount of iron we have. But so try to have at least one portion. If you know that your hemoglobin level is dropping down, it is already on a lower end. Probably at least one serving of any of these items. Either it can go some nuts, dry fruits, or something like that, or one greens in a day, or one palak or something, or one egg, whole egg we can have. Even egg yolk is good in iron content. So we can have one whole egg or something like that. You can incorporate in your diet, we can incorporate. So that is a natural way, apart from the supplements, we can incorporate the natural sources also, we can incorporate in the diet. So next comes your salt. If you ask me how much the salt recommendation for as per the Indian standard, we need to have at least 6 grams in a day. That is a normal consumption, not more than, not less than also. So 3/4 or 75% of the salt we eat is already present in what we already have into it, in the form of your breakfast cereals or food or soup powders, sauces, ketchups, everything. We have already some of the salt. First, for the preservative purpose, then we added some salt in it. So that's the reason we have to have whatever added for cooking, that will be safer, not have extra salt. Because consuming too much of salt in your diet also will lead to high blood pressure, which will lead to high risk of heart disease and stroke. That's the reason we have to excess consumption of salt. Whatever added for the preparation, say some sambar or making some vegetable or anything like that. How much ever salt is essential, that amount we can put it up. Not too less or not too high also. Lot of food also has some hidden salt. So we have to check whenever using any artificial supplement, artificial foods like sauce, ketchup or something like that. Check on the salt content in it. So the labels also shows how much salt is available in that particular brand or something like that. So current average intake is 8.6, that is 2 tablespoons. Recommended intake is almost 6 to 8 grams in a day we need to consume, in a day we need to have it. So 75% is already just available in the form of sauce, cereals, crisps, processed meat or smoked fish also is available. So the water. So water content consumption is essential, as I said earlier, that is also being included as part of the nutrient that's being because water helps to regulate your body temperature. It lubricates your joints. Some people will say, I have severe joint pains. Whenever I get up or when I wake up or something like that, or when I stretch my knees or something like that, I could be able to feel the sound or something like that. That is because of lack of lubrication. You can feel the sound, you can able to find it out. At least minimum 2 to 3 liters of water consumption is essential for any individual because not only for the hydration and lubrication purposes, even it is essential for your some of them will have a dryness or something like that. They come across dry skin or something like that, and some of them will have the eyes become very dry or something like that, and they become very tired and they feel severe joint pains. Even that is because of lack of sufficient water in the body. Even that could be one of the reasons. So it will also it helps to your toxins. The kidney to remove all the or flush the toxins from your body. It also helps to carry the nutrient which is essential for your body functioning. It moistens the tissues by the form of mouth, eyes, and nose, and also protects the body and organs and tissues. It also helps to prevent constipation. So this is one commonest thing which people will have to depend on laxatives. They'll be every day they have to consume laxatives to have a pre-born babies. So that is because if you're not consuming sufficient water, sufficient amount of fiber in your diet, probably you become constipated. So that is the reason we need to have some fiber and sufficient amount of water we need to consume in a day. And also it helps to dissolve minerals and other nutrients to make it's accessible to the body for the absorption. So that is the reason why we need to have water. So how much water we need to consume for a man? It is almost 3 liters in a day they need to consume. And women, they need at least 2.5 liters a day. In case of special cases like pregnancy or lactation, little higher, they need to consume it. Even, can I have 3 liters of water? Women, yeah, you can go ahead with that. It is not essential. It is not that you have to stick on 2.5 or something like that. You can do it more than that also. If possible, we can go to it. So, most of us, we have seen this label and we ignored it. During my previous slides, I found what is high, what is low. So when you see the labels, you need to find out what is high and what is low. Whenever you're getting any grocery shopping, something, any products like your simple your cornflakes or something you're getting it up, breakfast cereals or something like that. You can see the serving size. You can see just have a look onto it whenever you're going for it. So you just see how much is high, how much is low. So watch on the labels because some people they say they are sugar free, fat free, free from sodium, free from potassium, everything. There is no product can be stored without sugar, without salt or something like that because for the preservative purpose they need to add some sugar or salt in the product because they need to extend the shelf life of the particular product. That's the reason. But they'll be naming it out. They'll name it as sugar free or something like that. But the label will be having all these factors, all these namings. We can able to fancy names. We can able to see to it, like sucrose, glucose, fructose, maltose, ideal starch, or sugar. Even corn syrup and honey, they will be playing that. So this is also a form of sugar that has been hidden in the product. And what is high and what is low? The total fat, what is high and what is low is high is more than 20 gram fat per 100 gram. So if they claim it as 30 gram of fat in 100 gram of the product, that is high. So if it is 3 less is nothing but 3 gram of fat or less per 100 gram. So that is low fat. And saturated fat, what is high and what is low is high is more than 5 grams saturated fat per 100 gram. And low is 5 gram, 1.5 grams saturated fat per 100 gram. So changing your everything we talk about it. We have seen about the carbohydrate source, the protein, the mineral content, everything. Fine. How to change your food habits because you will be having a certain routine. You are following it up all these days. All of changing a habit is very difficult. 21 days of practice will make a man Perfect. So that is what we have to cover. So start doing it on day one. Slowly change your portion size, increase your vegetable, increase your vegetable consumption as much as possible. So little change in your diet can bring out a great change in your health and sleep. So when eating a meat, whenever you're preparing any meat for it or something like that, any type of cooking is better than fried. Don't go for any deep fried stuff or something like that. Go for shallow fried or even the boiled or steamed meat that we say for rather than go for deep fried or something like that. So try controlling on low beverages. They go for carbonated beverages, Whenever they go for a high fat meal, combo will be given as a carbonated beverages. They'll give a combo high carbonated beverages along with that. So people will, happily they'll get that combo with any carbonated beverages with a high fatty meal. But thing is actually there is no point in the protein what we are consuming. It's almost has been getting wasted because of consumption of the carbonated beverages. So there is no point in having it. So drink low calorie beverages as much as possible. Simple coconut water that is easily available everywhere. We can get it in street vendors. We get it up. So try to have water or unsweetened tea or diet sodas. We can have it up. Simple buttermilk or coconut water can be replaced in the place of carbonated beverages. We can replace it. And some people will say, I'm not having any time to have this, ma'am. I'm sorry, I don't have time to have breakfast at all. So in that case, what we have to do is at least try to have grab something like that, or even a glass of milk and a boiled egg or something you can have. But even that can be given to kid also. Because nowadays school starts at 7:30, 8 or something like that. So the kids will be skipping the breakfast. It's very, pathetic to see kids starting at the early morning, waking them up, getting ready, and by the time the school vans or the bus comes, they'll be skipping the breakfast. So at that point of time, what we can do is just give them a glass of milk and even a boiled egg or something, we can give it to them, or even a fruit can be given to them. So even that is sufficient at that point of time. However, they have a bit morning, they have a break. During that time, they can have something else, they can be compensated. So even for an adult, we can have some, we can grab fruit or something like that. Have a glass of juice or fruit. Instead of having a juice, try to go for a whole fruit rather than go for juice because we need more of fiber. So try to have as a whole rather than juices. So try to change your meal pattern as much as possible. Regular meal, balanced meal, we have 3 meals a day. Instead of that, we can make it as a high portion, make it a small pattern if possible. Having morning a breakfast and in between 10:30, 11 o'clock, okay, have your tea break or something like that. Try to have something like that. Have a food instead of having going for coffee or tea. Or you can have buttermilk, or even you can have coconut, or you can have grab of fruit or something like that. Some nuts we can be carried out so that you can have it up. And you can go for your lunch, evening you're during tea time, you can go for boiled chana or something, we can have it. So missing a meal may result in high quantity of high energy foods being great for consumed. So what we people is thinking is, okay, I want to cut down on my weight. So what they do is first thing is they keep, they want to cut down on the breakfast. So they want directly go to the lunch. Unfortunately, what happens is when you cut down your meal, tend to eat more during your next meal. So that will happen. So don't ever do it. Try to cut down your portion sizes. So already I'm having 4 idlis in a breakfast for a breakfast. Try to make it 3. And then gradually we can cut down on the portion size. That is how we have to do size, not quickly cutting down as 2 or something like that. So see, your body is also just like machinery. All of a sudden, if you change your pattern, the body will be functioning like a normal, it will not be functioning like a normal. So whatever changes you're doing it up, do it slowly, but patiently you have to do it. And you have to wait for the results later on. And meal times are a good opportunity to get a family together. So at least, as I said earlier, try to have one meal, the full family together, have a meal at least once a day. We have to once a day we have to do that. And breakfast is an important meal of the day. So break the fast. People who consume about 45 breakfast, even cornflakes, we can have a meal, we can take it out, add some nuts into it, and have that is good amount of protein. So that's also good fiber also. So try to have at least that way and have switch soda or carbonated water or buttermilk we can have. But late night snacks. So some people will be working on late nights, they'll be working. But so immediately what they go for is they go grab with some junk food items or something like that, fried items they'll be having to it. So in that cases, what we have to do first, we have to go ahead with some fruits or even salads, vegetable salads we can have. Some healthy snacks we can have it, which will not add on calories, which will be beneficial for their health so they can have it. So changing a lifestyle use staircase instead of escalators as much as possible, but we'll be gasping initially, but gradually we can do it up. So that is the way we have to cut down on the weight also. Climb up and down the flight of stairs during a break. So if a people having a work content sitting in a work one table or something for long hours and doing some work or something like that, even that is not advisable. Even that also recently people sitting and working for more than 5 hours or something like even that causes cardiac arrest. So even that is not advisable. Yeah. So what you have to do is that is once in a while you have to go on and have a break, just climb up and down, and then back to seat and then continue. So that can be done. On weekend, as for screen of transport nowadays, we are having semi-heavy traffic or something like that. At least we can leave your cars or some your bikes or something. Have a walk. At least we can take your trains or something. And the first before your stop, we can get down and have a slow walk. We can do it at least once a week. We can do it. Or if you're going for a gym, at least we can do some exercises. We can do it up. So 20 to 16 minutes of exercise is required in a day. At least weekly 5 days we need any heavy exercises or something like that. We can give a break for 2 days also. We can do it up. But we have to restart the exercise and then starting. Ma'am, I can't do any heavy exercises. What is the option for that? Simple walking. We can start with half an hour. Gradually increase for 45 minutes the next week, and then we can increase to 1 hour. So this is how we have to do it. Not immediately starting for 1 hour will be leading to severe body cramps, pain or pain will be happening. But so what you can do is when you're starting for going for a walk, start with half an hour for a week. Stick on to it. And then we can gradually increase to 45 minutes, and then we can increase to the similar way with the 45 minutes for next week, whole week we have to continue. And then we have to increase to 45 minutes, the 1 hour. For the next following week, we can do it down. So if you're able to do some workouts or something flexible exercises, also we can do it as much as possible. Next comes your sleep. 7 to 8 hours a night sleep is essential for any individual. Excess sleep and oversleeping is also not good for you. Or you who little sleep and who oversleeping is also known as it's not good for it. Recently, I come across one study. They were saying we can having a long sleep reduces the heart attack. How much thing is possible? I really do. Probably they are coming up with some researchers. They're doing it. Weekend they'll be waiting for the weekend. You know, they'll be sleeping at least more than people usually wake up at 6 o'clock. They'll be waking up at 10 o'clock. The excess sleep also will reduce your risk of becoming having a heart disease, something like that. So that is also being known to it. So oversleeping or too little sleep is also not good for any individual. People start using mobiles, keeping the screen timings very increased. And I know even that diverts the sleep, that disturbs the sleep also. So try to cut down that as much as possible. The way to reduce stress is a complex thing which every individual takes their attention. So identify the cause of stress as much as possible. Share your thoughts with the feeling one. In spite of talking to the other person, making it more worse, it is better to talk to the same person and get it sorted out. Rather than beating around the bush, we can try to sort it out with the same person and solve the issue as much as possible. Discuss the cause of stress openly with concerned people and try to avoid the unnecessary situation as much as possible. And realize that there are other people having similar problems to yours, not to you. People will be facing lots of other problems also. Simplify your life and manage your time and conserve your energy. So these are some stress relief diets. People will say, "Ma'am, what is special? Everything is fine. Any specific food to reduce your stress? Eggs can be taken, garlic, tea, almond, oranges, dark chocolates, walnut, cashews, milk, avocados also can be taken. So this can be as a part of a thing. Meal you can incorporate it rather than nothing else. Positive lifestyle, having a healthy diet, rich in multinutrient, 8 to 9% sleep, maintaining a healthy weight. That is much more important. So doing everything will bring to your weight, check on your weight, and try to stick on to your ideal body weight. So that will prevent your any lifestyle diseases can prevent. So that's the reason try to stick on to your weight also. And regular doctor visit is essential for any individual. Active lifestyle is essential for everybody. Exercise or increase physical activity as much as possible. Educate yourself about the nutrition. So I'm just ending up my session. Any questions?
Thank you, ma'am. Dear participants, we have any question, kindly post it in the chat box. Otherwise, you can unmute your mic. You can ask your question. Dear participants, kindly post your questions in the chat box. Thank you, ma'am. On behalf of the management and academic staff college, I would like to extend my sincere gratitude to Roji ma'am for delivering an outstanding session at our FDP. Thank you for the time and effort, ma'am.
Thank you so much. Thank you.
Okay. I thank all the participants for the active engagement. Thank you. Thank you, ma'am.